I'm Amanda, and I work at a hospital in Scranton, Pennsylvania.
My name is Andrew, and I work at Multicare Hospital, which is in Washington State.
Where do medical professionals get information?
We have it sent out for us internally, pretty much on daily basis, and weekends usually a little bit slower. But during the week, we have lots of emails, updates, constant updates on our states mostly. New England Journal of Medicine website, we use that one. Up to date, have some information as well.
What's it like at the hospital right now? Do doctors work regular hours or have things changed?
Currently, I float all over the hospital, anywhere from the emergency room to the med surg floors. And just recently, I worked on a floor that did have a positive patient on it. Right now, the doctors are working regular hours. Patients are coming in for their pre-admission testing, their blood transfusions, chemotherapies, and such as normal. The only limitation right now is in visitation. There are no inpatient visitors allowed.
Nurses in our hospital work 12-hour shifts. Doctors, they work 12-hour shifts as well, 7 on, 7 off.
How do medical professionals like yourself, how do you keep yourself safe?
We do the best that we can. There's a shortage on PPE, which is the personal protective equipment, such as the face masks, the gowns, the gloves, things of that nature. Currently, where I work, there are no face masks, the actual visors. The N95 masks that the WHO and CDC recommend wearing are in limited supply and are being handed out one at a time with close scrutiny.
If you go to those designated unions, obviously you're going to see nurses and doctors and everyone else. They're going to have, like those kind of helmet looking things, with the plastic glass. And then they have masks there, which is a big shortage of them right now. If you have a mask, just wear the mask a day, the whole day. Because if usually we used to have a mask, we would just use a mask, and then we don't need it, we just throw it again. And then if I need it again, I just get another one. But now they try to conserve that.
It's a little rough. My family and I all think of ourselves as carriers because not only do I work in the health industry, but my mother is an LPN and works in it as well. So we look at ourselves as carriers and we quarantine ourselves on the weekends to prevent any spreading.
So what are those symptoms of COVID-19 and how are they different, if they're different from regular cold or a flu?
Usually patient starts with fever and then cough, but dry cough. Also at one point after that, you might feel like you cannot breathe. 3 big things there.
If you have a dry cough, if you have a fever of 100.4 degrees and are experiencing shortness of breath, that's when you want to go call your emergency department first before you just show up. But those are the signs of the COVID. The problem I know in Pennsylvania, and from what I understand nationwide, is there's not enough testing kits available. They're very strict on who gets tested versus who doesn't.
And if you show up with symptoms, it doesn't mean that you will get tested? Is that it?
No, unfortunately not. My friend's daughter right now is presenting with all the symptoms and they will not test her.
Does that mean the care is denied, or is it just testing is denied, but people are still treated?
Well, it's the testing that's denied. The treating for COVID because of the symptoms is similar to that of the common cold, where you're going to be treated with Tylenol and fever reducers. The ones that stay in the hospital are those that need more oxygen therapy. Otherwise, you're better off just staying home and treating yourself.
I guess we hear in the news that a lot of those patients are actually elderlies, I guess.
From what I've been reading and what I've garnered from talking to other healthcare professionals, it really does spread across the spectrum of people. However, it does have a tendency to go towards the elderly and the immunocompromised the most because their immune systems just can't fight it off the way the younger generations are able to.
65 and above, people with underlying conditions, diabetes, high blood pressure, immunocompromised people, people that have some type of oncology situation, or people with transplant as well.
I could have it and not develop any symptoms at all because I have a healthy immune system. My body can attack it and I may never know. But if my grandmother were to catch it from me because she's elderly, she's a little weaker, she would be more apt to show those signs and symptoms and have the respiratory issues.
We hear that capacity for hospitals is a potentially big issue. Maybe already is a big issue. I don't know. What do you see? What do you experience?
I know the one floor that I was on was full. Every bed was taken. We only have one other floor available, and I'm not sure what the census was like there. but I know it was rough.
And if the hospital is full and the person shows up and they are sick, what happens?
Find room.
You'll find room.
Yeah, I mean, in our
Hmm.
emergency department, they've been known when they're at capacity to treat patients in the hallways if that's what's required. So you're not going to be turned away. There will be alternatives found, whether it's being treated in the hallway or putting up a tent, there will be an alternative found.
I guess for regular folks, what can people do to protect themselves, to protect their loved ones?
Yeah, really good question. Try not to go outside too much, especially if you're elderly. And all the people, my relatives, I already instructed a lot of people there that not to leave a house. If they need anything, they can call us. We just bring them food, produce, just set them by the porch and then leave. But these people should not be walking around, especially if you're like I said, over 65 and have some underlying conditions.
To protect yourself, I suggest, of course, wash your hands. Don't touch your face, which I do all day long because I chew on my fingers. So I am a horrible example for that one. The virus is known to live on your clothing, on your skin for 3 to 6 hours. For the elderly, if you have elderly family members or neighbors, go to the store for them. Ask them what they need and help them out as much as possible so they can stay home, because they're the ones, again, that are going to have the most trouble fighting that off.
If you know someone who is a nurse, doctor, any type of medical profession, just show them respect, buy them coffee, make them lunch, and just send the lunch with them, because a lot of them just literally don't have time. Because if you work 12 hours, you start at 7, you finish at 7, but then you have to chart, you probably leave around 9 o'clock, and then you come home and you sleep. You don't even have time for preparing food. And a lot of these people also have families to take care of, and they have also their elderly parents to take care of as well. Be mindful, and if you know someone like this, maybe see how you can help.
We're not the only ones out there. My mom, like I said, works at the nursing home. Today's her day off. She's out handing out bagged lunches at the truck stop for the truckers. They can't go through drive-thrus. It's not just the healthcare community. We got to remember we're all in this together, and we got to be there for one another.
Thank you so very much. This has been a blessing for me to hear this. It seems like you and other medical professionals are doing God's work. Thank you so very much. And thank you so much for this interview. I really appreciate your time. Stay strong on the front lines, okay?
Thank you. You guys stay safe too.